Yeah, so yeah, no, I'm not surprised at all. Actually, I've been onto this channel for over a year now, and while people talk so much about vaccine, let me just play the advocate for the devil on the other side of the vaccine. The vaccine-only approach is problematic. It's incomplete, and you may have seen the report from CNBC 2 days ago, and July the 30th, is that about 75% of the new infections in Massachusetts were all from those who were fully vaccinated. Why is that? One of the major issues is the inherent problem of vaccine-only approach is because, in fact, viruses mutate so rapidly. That's why we have these, flu vaccine every year. COVID-19 virus mutates, so vaccines are only part of the solution, not the complete program policy. I have been advocating that we need more complete approach, particularly on healthy lifestyle, nutritional immunity. And that's one point I want to point out, is that the vaccine is only part of the solution, not the complete solution. The other part I want to point out is that, let's define new infection. Positive for COVID-19 does not necessarily mean infection. These numbers may increase dramatically. However, they are not necessarily scary. It's the sick, it's the seriously, critically sick COVID-19 patients that are more concerning. So that's another very confusing point in the news program that is problematic in my view.
Dr. Fauci on Sunday morning said he expects things to get worse before they get better, but does not expect lockdowns, new lockdowns. Why?
Oh, I totally agree. Actually, we have to ask a question. 18 months, about almost 18 months into the pandemic, is the COVID-19 hurting us more, or the global lockdown hurting us more? We have to understand this is a double-edged sword. And if we lock down for too long, that will create a lot of hardship in people's lives that can cause a lot of more problems. So what I've been saying, also look at statistics that young people, the case fatality rate of COVID-19 is similar to a bad serious influenza. So it's not that scary. We should encourage normal lifestyle for most of people. Only those who are at high risk, like seniorly, elderly, and chronically ill and pregnant women. These people, we may need a little bit more protection. Otherwise, we need to encourage people to move on with, normal lifestyle and live a healthy lifestyle and take a balanced nutrition, healthy diet. All these are very important measures in a immunity against diseases, not just the vaccines, masks, and lockdowns. That's what I've been saying, over half a year now, more than half a year now.
Some countries, Israel, Hungary, now pushing a third vaccine, a booster. Do you expect that here in the U.S. as well?
It's possible. Yes, it is possible, but I doubt, it's going to be effective, because this, vaccine is reactionary. You are waiting for a new strain to appear, and then you develop a vaccine against that strain. But, that damage is already done. So it's by inherent, because vaccine is only effective against a known sequence, and it's again only part of the solution, not the entire package. And so this vaccine only, mask only, lockdown only, it's incomplete. It's not a good policy and a national standard.